Hi, I'm Dr. Richard Downs. Thank you for coming to this webinar. Many of you have come here as a result of visiting my website, onlinehomesleepstudy.com. Many of you have also taken the online home sleep study test in the convenience of your own home. What I offer is I help you interpret the report that comes back from that test. A qualified MD physician in sleep medicine will diagnose that test for you. Once you receive it, we'll do an online consultation for those who wished it. There's no cost to that as well. And I'll help you interpret that study and answer some questions for you. I'm going to first talk to you a little bit about snoring and obstructive sleep apnea. And this is for everyone. This is not just a specific group of people, young or old, or women or children or men. It's for everyone. But I am going to specifically talk about women and children who are often ignored in this subject area because they think this is just a disease for old men who are heavy. So let me share my screen with you, and then we'll go over some of this information. All right, let's go back to the beginning. I'm going to skip the hummingbird. So, snoring. It's not just a noise. My name is Dr. Richard Downs. I'm a dentist in Iowa, and this is the website that many of you have come through or are familiar with. If some of you have taken the online quiz to see if you need a sleep study, and some of you have already taken the sleep study. First, I want to show you this video. I just got this yesterday. It's my nephew, and this child is a little boy who's 5 years old. I want you to see what happens here while he's sleeping. It's not normal for a child to snore. Now he stopped breathing. Now he just woke up from his stop breathing. So that's pretty dramatic. A lot of children have a sleep restriction while they're sleeping. Sleep apnea is when the airflow is either restricted or cut down, or they completely stop breathing for a while. And the two together are called apnea-hypopnea index. They give a score to that to see how severe your sleep apnea is. So let's go ahead and talk about what we're going to go over. This is a very short webinar, but I want you to learn something. I don't believe that people who know more are harmed in any way. I'm not going to get too technical. I'll explain some of the technical words, and the seminar will be short, but it should be informative for you. Snoring, as we said, is not just a cosmetic or annoying problem. In other words, it's not just a noise. Snoring in and of itself can cause damage. Now, snoring often causes or leads to obstructive sleep apnea. As a matter of fact, it is estimated that 80% of those people who snore have obstructive sleep apnea as well. Snoring causes a number of health problems. Stroke, heart disease, it can lead to diabetes, it can contribute to weight gain, even Alzheimer's, early onset Alzheimer's has been linked to obstructive sleep apnea. Snoring can also cause loss of sleep for your sleep partner. If they're in a room with you and they can't get into the deeper stages of sleep because of the disruption of the noise, they may not reach the stages of 4 and 5, the deep sleep stages that are restorative to both your physical health and mental health. Snoring definitely worsens over time as people get older. So snoring might start out as harmless and then progressively get to the point where it actually becomes obstructive sleep apnea. And snoring is a sign that you should be tested. As a matter of fact, if somebody tells me they snore, I believe they need to be tested just to rule out, if possible, obstructive sleep apnea. And here's a post or a photo of a patient's back of the mouth where just snoring has caused an elongation of the uvula. It's long and flabby. It's not tight, short, and firm like it should be. This is because the muscles and the nerves in the soft palate have been damaged by that vibration. Let's talk a little bit about women and heart health. In this study by Dr. Adrian Kurta in Chicago, they found that both men and women with sleep apnea and snoring tended to have larger left ventricles of the heart, meaning the walls were enlarged of the heart and the heart was working harder to pump blood. But when the snoring group was compared to the unaffected group, a more significant difference was found in the size of the left ventricle among women as compared to men. These cardiac changes in self-reported snores suggest earlier heart impairment in women and could point to undiagnosed sleep apnea. Here's another quick survey or a study on axon and Schwann cell damage caused by the vibration of snoring. Now, axon and Schwann cells are cells associated with nerves. And in this study, in preterminal nerves of the soft palate, that means the roof of the mouth, is associated with pharyngeal dysfunction, that means swallowing problems. In snorers and patients with sleep apnea, the most likely cause of the nerve injuries is traumatic snoring vibrations and tissue stretch, leading to swallowing dysfunction and increased risk of upper airway obstructions. As we said, obstructed airways are either slowed airway exchange when you breathe or complete stoppage. Here's another study. Snoring was associated with chronic bronchitis and lung fibrosis. In this study, they determined that the vibration of the soft palate might inflame the lungs. I don't think that's the reason. They don't know what the reason was in this study, but they just show the association. I think a study needs to be done on snoring that causes the inhalation of bacteria, viruses, and fungi, yeast from the mouth and nose into the lungs. I think that's possibly a cause of this chronic bronchitis and fibrosis, but a study needs to be done to show that. Now, this study doesn't talk about that at all. It's just an observation from this person who is, I am a dentist. And then in this study, expiratory snoring, that means snoring when you breathe out as opposed to snoring when you breathe in, was associated with more breathing disorders than inhalation snoring. Now, the good news is the soft palate can heal. And what we mean by that is in this study, brain-derived neurotropic factor, that's a kind of a healing factor or a tissue growth factor in the body, was found to be increased in the vibration of the soft palate when you snore. But the conclusion was that damage of upper airway muscles might heal following treatment for snoring and sleep apnea. In other words, this upregulation or bringing in this factor into the tissues might allow us, if we can get this snoring stopped, to reverse some of the damage to the nerves, denervation and reinnervation, and repair of muscle fibers. And I believe that's true. As a matter of fact, snoring can be reduced by both oral appliances that dentists make you and by CPAPs. Oral appliances tend to have a better result with snoring because it brings the lower jaw forward and the tongue comes forward out of your throat, and it tends to open the airway and reduce snoring. Doesn't eliminate it for everybody, but it does tend to make it lower. So I mentioned before that 80% of those who snore have obstructive sleep apnea. So the fact that you snore, I believe, indicates that a person should be tested. And we do that on this site, onlinehomesleepstudy.com. So why would we have an online sleep testing service? I started this because there are over 40 million people in the US walking around with obstructive sleep apnea. And they're not being diagnosed, and the population is getting older and heavier, and more people are being diagnosed with this. As a matter of fact, more people are going into it, but the vast majority are not being diagnosed, especially if we have to do this in sleep labs and hospitals, and you have to go to a physician to get a prescription for that test so that your insurance company will cover it. It adds increased cost. Even the deductibles on your insurance are more expensive, oftentimes, than this online test is, significantly more. A sleep lab test can be in an area of $4,000. The deductible, $500 to $1,000, much more expensive than this particular online program. But we also did it for other reasons. And the reason we did that is because many people want privacy. They don't want their insurance company to have this record of this test or a diagnosis that they might have sleep apnea on their records at all, not in the medical record, nor do they want it on their insurance records. Some DOT drivers and other types of public transportation individuals for airlines and ships and trucks want this private so that they can remedy the situation before they actually have a qualifying test done. And that's fine. We can keep their information private much better by doing it this way. As we said before, we lower the cost because we're going direct to public. We have a great volume of people getting these tests done. And we don't have to have extra doctor's appointments to do this that add to your costs. By not going through insurance, much of the cost is lowered. There are going to be fewer car accidents and trucking accidents too. This lowers costs for the national health of our nation. The Exxon Valdez was sleep apnea related. The 3 Mile Island accident was sleep apnea related. As we said before, there are 40 million people undiagnosed with obstructive sleep apnea, and many of them are being treated for stroke and heart disease with drugs and surgery, diabetes, high blood pressure. And the last statistic I saw was 154 billion people, or $154 billion a year is being spent on people in the US for diagnosis and diseases related to sleep apnea. Why don't we go to the source and lower those costs? I think we can. And that's one of the objectives of our site is. And then, of course, the concern for your loved ones, your sleep partners, and those who care about you also are going to be addressed. So how will this make your life better? You will increase the likelihood of having better health. You can lower weight. Matter of fact, weight gain is significantly related to sleep apnea because of the cortisol produced while you're sleeping, which is a stress hormone, brings weight onto your body. It makes it difficult to lose weight. And all the associated problems with weight, high blood pressure, diabetes, can be remedied or helped at least by getting this under control. So I will do a free consultation for those who have already ordered the test. I'll help you interpret that test when you get that test result from the MD who diagnoses it. And we'll go over that together. I can help you with decision making as far as finding a healthcare person who can help you if you'd like. Some of you won't have a problem because you won't have sleep apnea. That's fine. For those of you who have questions, we will present an online scheduler so you can schedule your time with me. Those who want to write to me and have questions can write to support@onlinehomesleepstudy.com. That's support@onlinehomesleepstudy.com. I look forward to speaking with you. Thank you very much.